Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome. My name is Abdurrahman Gaddafi Yassin, and this is Stay Healthy, a program that comes to you each and every Tuesday morning where we teach you more on how to stay healthy. Today, our topic of discussion is going to be epilepsy. With me in studio is Dr.Mahendra S. Chouhan. He's going to tell us more on the matters to do with epilepsy. And remember, the program is brought to you by Nairobi Neurocare, which are the ones we are having a lot of discussion with them. They give us solutions on the matters to deal with our health today. Good morning, Dr. Ari.
Good morning.
How are you? Everything's good?
Yeah,
today our topic of discussion is epilepsy.
Yes,
and according to a small research that I have here is that epilepsy is a chronic non-communicable diseases of the brain that affect people of all age. 50 million people around the world have epilepsy, making it one of the common neurological disease globally. It is scary,
yes,
Dr.
It's very scary, but let me scare you more.
Okay.
Only in African continent.
Yes.
The number of epilepsy cases, according to WHO, latest,
yes,
is 25 million.
25 million.
Yes.
That's a day or?
No. These are the total cases
total
for
cases.
now.
Okay.
And mostly they're residing in low-income group or medium-income group countries. And most of the African countries are low or medium-income group.
Okay.
And so there is such a huge figure of epilepsy which is there, and not too much is done about the epilepsy, which is Nairobi Neurocare's focus of doing and curing epilepsy.
Maybe try to make us understand, and my viewers back at home, to understand the full, what is epilepsy, because some of the people, they think epilepsy is a witchcraft.
Yes, I hear it much more than other parts of the world, and I have done interviews on other TVs also. I was talking to a pastor who himself, when he was planning to go to India for the epilepsy treatment for his own sister,
yes,
he was actually demoted from his job because he was saying that epilepsy is not a witchcraft.
Okay.
Yeah, and so we had an interview on TV. So epilepsy is definitely, it's a condition, clinical condition in which it's basically epilepsy. There is a convulsion and there is epilepsy.
Okay.
Convulsion is where, because of some problem in the brain, because of irritation of brain, maybe because of a tumor, because of hemorrhage, because of an area which is not having a blood supply, or even an injury, can cause epilepsy, where there is a brain irritation which translates to movements in the body of different types, maybe one half of the body, one part of the body, or whole of the body. Yeah, so depending upon that, whether it is a focal convulsion or it is a generalized convulsion. It can be associated with unconsciousness, or a patient may remain conscious, but typically it's the shaking of the hands, or sometimes they just become tight in one posture and gradually losing into kind of a convulsion where there is a movement to and fro. And these are mostly very violent. They are associated with tongue bites, passage of urine or poo-poo. So this is a typical convulsion. When someone gets 3 convulsions in a year, then the condition is called as epilepsy. That means single convulsion, if there is an isolation, it can be just because of high fever. But if there are 3 or more than 3 in a year, then there is something permanent inside brain which requires treatment. So one episode we can still observe, but now if we are talking of 3 episodes, then we require a proper workup, and then we need to give patient a proper medical treatment.
Maybe tell us what causes this type of illness.
It depends upon which age a patient is getting epilepsy. So lot of, in developing countries, pediatric epilepsy is very, very common. And as I am practicing in this country for last 5 years, but we are practicing epilepsy for last 25 years, we have realized that in developing countries, the babies, when they are born, they do not have enough care during the delivery period, where they can either get a low oxygen environment, because maybe the delivery was delayed, the cesarean section was not done in time, or the baby had some problem during the delivery, which is called as perinatal insult. So then the baby did not receive enough oxygen in the brain, or there was a delayed cry. So all of this will cause a damage in the brain which is usually permanent.
Okay.
So now brain cells are damaged and they are generating abnormal electricity. Remember, whole of the body activities, they have a microelectric current. So brain cells also communicate with each other by generating very small amount of current which we can measure. Okay? Just like in heart, everyone sees there is a ECG which is done, electrocardiogram. For brain also we can do electroencephalogram, EEG, which will measure the waves. There are different types of waves, and so we can map from where abnormal waves are coming. So these abnormal waves eventually translate to abnormal body movements, which are called convulsions. Later, when the child is, say he is born, and then after a few days, 2 to 3 days, he starts developing jaundice. Now this jaundice can go very high, which is called connectors. If it is not identified early, or if there are no proper measurements in the primary health care for these babies to reduce the bilirubin, which is a yellow pigment, that goes into brain and that damages some parts of the brain. So there is a permanent brain damage.
Speaking about jaundice, this is what makes maybe the young babies to look yellow. You turn
yellow. Yes, yellow. So what happens that babies were living inside a mother's womb in a water condition, aquatic condition. The lungs were collapsed, and baby was getting oxygen through mother. Okay, so baby did not need to breathe. As soon as baby comes out, the lungs should open just like a parachute opens in the first few moments of a fall in air. If they don't open, then the oxygen will not reach to brain, and that will cause damage. Right? So that brain damage will happen. Now what happens that in the initial part, when and this is the same condition where there is too much blood or red blood cells in the child, so hemoglobin is high in babies, and now when they are out, they don't need that much of red blood cells, okay, or they don't need that much of hemoglobin which is catching oxygen. So now that goes down, so body breaks it down. When it breaks it down, that yellow tone converts into a yellow pigment by the liver. So that yellow fever, that's natural. All babies should have jaundice, but it should not go beyond a certain point. So it requires proper monitoring and proper management. Okay. So beyond a certain level, it will cause damage to brain and a permanent brain damage.
Okay. You speak about brain. Maybe you can tell us maybe the specific place in a brain where is being affected by this epilepsy illness.
So these are mostly the basal ganglion, because now it's too much technical discussion. So, but when it is jaundice, it will cause more damage to the basal ganglion. But it has got a widespread damage on the brain. Yeah, the research are still on, but basal ganglions are the one which are controlling our normal body movements. Like if my hand is steady, it is not having a tremor, then the tremors start because of basal ganglion damage. Yeah. So all these are a part of a perinatal, we call it insult to the brain, which is causing movement disorders, convulsions, autism, and abnormal behaviors.
Is this something that is related to a DNA, whereby someone can inherit?
There can be a predilection or more chances of having a convulsion. Say someone got a high fever, say 103 degree of Fahrenheit, then it may be genetically affected, but it is not genetically transmitted usually.
Okay.
Yeah. Are you getting my point?
Yes.
You may get a higher chance of getting an epilepsy in certain situations, but then there are so many causes. As I said, tumor can be a cause. So if I am seeing a person who is like 55 years old, had no problems at all, now recently got a headache and got a convulsion, I would first suspect a brain tumor or some problem in the brain which has grown something new, because neoplastic problem.
Okay, maybe let us speak. What happens if maybe epilepsy happens when someone is asleep?
So there are a lot of types of epilepsy which happen only in the night, only during the sleep. Yeah, these are called nocturnal epilepsies. They are there, and almost say 15% of my epilepsy patients, they have nocturnal convulsions. They don't even know that the convulsions are coming. It's always somebody sleeping with them tells that they had these kind of convulsions. Mind you, all epilepsy, all convulsions are an episode where there is a very less blood supply to a highly active brain, and brain cells require most oxygen per minute. So there is a highly increased activity and there is decreased blood supply. This causes a brain to swell for a while. Okay, and at this time patients mostly become unconscious and they can vomit. So they can aspirate their own vomit, it can go into lungs and it can cause death. So most of the convulsions, which are we call it generalized tonic-clonic convulsions, can be actually deadly. And each time there is a convulsion, it is damaging brain further. So there was a brain damage, there was convulsion, then there is a further brain damage during convulsion, and there is further more increased frequency of convulsions. So it's going to be a vicious circle. So we have to prevent convulsion as soon as possible.
And maybe give us the ways of preventing this.
We can't prevent it unless we are properly working it out and we are giving a medicine.
Okay.
Now, not all patients will respond to same medication. Every patient will have a different response profile. Okay. Then even if 3 patients responded same to one particular drug, they may have a different adverse effect profile. They may have different reactions, like they may have, one can have a skin rash, the other can sleep excessively, and the third one can have something else. Like I had a patient who came from somewhere else. She was treated in Nakuru, and she took a very common drug which we give it daily. But as soon as she took it, whole body developed blisters on the skin as if she was burnt. So she was admitted in a burn ward for a good 1 month. Okay, and she came out. But I have seen these are extremely rare genetic situations where a patient is prone to such reactions, which is called Stevenson-Johnson syndrome. But how do you know that this patient, because the less the frequency of anything happening, the more rare it becomes and more difficult it becomes to diagnose them. How do we know? So we take a consent from the patient that you may develop this serious condition. Don't blame us. It is your enzymes, your genetics, which is reacting so highly abnormally. But this can happen. But mostly, you give medications and most of the patients respond very well to medication.
So epilepsy, it's of different levels?
Yes, it can be different. The severity is different, the frequency is different. I have seen children having convulsions, 100 convulsions in a day. Every day. They require much more than medication. They may require a surgery, they may require some device to be put into brain, which can stop convulsions. Okay. Now epilepsy management is far, far more advanced than it is usually perceived to just as medication. Yeah. And fortunately I am trained in such ways, few of the world's best places, where we have been doing epilepsy surgery for long. We know when to do surgeries, when not to do surgeries, when to put a device in the brain to stop it, and the success rates are excellent.
Wow, that's nice. And I hope my viewer back at home, you're really enjoying and also getting a lot of information about the epilepsy disease or illness where you're watching us from. And indeed, it is very scary. If a child can get the convulsion maybe 10 times a day, it is not a good information, or it's not a good thing to see. But we're taking a short break. When we get right back, we're going to discuss more if it's a matter to deal with our lifestyle and what are some of the medication that Nairobi Neurocare, they are ready to offer so that they can heal this illness. They can cure rather this illness. Assalamu alaikum.
HorizonTV, the beacon for the nation.
What makes the exchange of goods and services interesting?
From the word Fayaz Bakers, anyone can know what we are doing. So, but mostly we are known for our cookies and cakes.
What makes human beings seek for needs and wants?
when the customer takes the trip, we make sure that we call them and we say, how was the trip? And they'll be like, oh, the trip was good, it was nice, okay, we've rewarded you with this.
What makes the young venture into business?
Alipenda kufanya sadaka and stuff. Alipataka kufanya vishete, so I told her, let me make vishete. So akanipatia kila kitu, I did it, and they turned out better than hers.
But what really motivates their actions?
I was telling brother, it's difficult.
Join us on Show Me the Market as we seek to understand the market of different businesses for young entrepreneurs, only on Horizon TV.
Verse of the day.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. وسيق الذين اتقوا ربهم إلى الجنة زمرا حتى إذا جاءوها وفتحت أبوابها وقال لهم خزنتها سلام عليكم طبتم فادخلوها خالدين وقالوا الحمد لله الذي صدقنا وعده وأورثنا الأرض نتبوأ من الجنة حيث نشاء فنعم أجر العاملين.
On the next episode,
Quote of the day. Imam Muhammad bin Idris al-Shafi'i said, to admonish your brother in private is to advise him and improve him, but to admonish him publicly is to disgrace him and shame him.
Horizon TV, the beacon for the nation.
Ukipata matatizo, tumesimama. Sio kudai kwamba mimi napenda Mtume sallallahu na kisha unaanza kuleta mambo ya bid'a. Utasikia hao ndugu zetu ukipata matatizo, kwanza wakisema tu, nasema Jesus Christ. Oh Jesus Christ. Ewe Isa nisaidia. Ndio maana yake. Nisaidia Isa. Na sisi leo tutapata baadhi ya Waislamu wakifikiwa na matatizo, neno la kwanza ya Rasulullah, wengine ya Ali, ya Hussein. Ilikuwa hofu yake kubwa ni kufunga ule mlango wa shirki. Unaona sahihi kwamba uchawi limekuwa ni jambo la kawaida katika jamii ya Kiislamu. Aina la ilaha illallah, iko wapi la ilaha illallah?
Horizon TV, the beacon for the nation.
Assalamu alaikum wa rahmatullahi wa barakatuh once again, and welcome back. This is Stay Healthy. My name is Dr.Mahendra Gaddafi Yasin. Our topic of today is epilepsy, and before we took our short break, the doctor was trying to explain more and to expound on how the causes and how maybe to manage it. But right now, we want to speak about what Nairobi Neurocare do or treat in terms when it comes to matters of epilepsy. Maybe what are your niche in this?
Yeah, so there are a lot of doctors, a lot of patients who are getting treated, or they are treating by just generic medical treatment.
Okay.
Yeah, you go there, there are certain drugs with first line, second line, third line. That's a very conventional way of treating epilepsy. But it's most important is that you need to know then what kind of epilepsy is this, okay? Because the drugs, there are epilepsy specific drugs. Then you need to know with a very good quality EEG that from where these are coming, whether they are focal or they are generalized. Say, I would like that we shift towards our presentation so I can show you the importance of EEG. So these are the electrodiagnostic services that we offer. They are very important that if you are properly diagnosing a problem, then you can reach to the core of a problem, and then you can treat it much better. So most of the epilepsy treatments, they are tailor-made. I mean, there can be 10 patients with convulsions, but each will have a different profile, each will have a different EEG, and based on that we will plan whether we should go for medicine or we should work them out for surgery depending upon their response to
And
drugs.
does it go away by time?
Yes, it can. So I'm still waiting that we go and see our presentation.
Okay.
Very small one so that people understand what is EEG.
I think my producer can put the presentation on the screen so that at least, it's there.
So you see that there are waves which are created.
Yes.
Okay. These waves are coming from brain, and this is how they are seen on the EEG, which can be recorded.
Okay.
Now there can be a grid which is put, and then the wires, these convey the signals, and that we can see on computer, we can print. Okay. And then there can be another level which is called a stereo EEG. So there are patients who may require much more than a normal EEG. Before this, so there is EEG, then there is a VEEG, there is video EEG, where you admit a patient, you put the patient under a camera, and then you monitor along with the EEG which is going on with their actual convulsions. So we can actually correlate where exactly it is coming from, which part of brain is it coming. And then the third thing is, even if then we have confusion, then we have robot assisted machines which can exactly put, say we got say one particular area, as I say it's a temporal lobe of the left side. So now how do we do that? How do we know that left temporal EEG has told me? But these are all we are recording from the surface. The brain is still deeper inside. So now what we do is we take the patient into the operation theater, and through a very precise technique we can go and we can put these electrodes deep into brain, and then we monitor the patient for 7 days, 10 days, and then we come with the profile, because the idea is if there are patients who cannot get a medical cure, then we will work them out for surgery. So we have the entire thing worked out as to when to do a medical treatment, when to do surgery. So as we will go further and discuss that, what will be the ways to cure epilepsy.
Maybe when is the right time for one to go and seek for the medication?
As soon as you got 2 convulsions, you must come and see a doctor. Even first convulsion is a very serious event happening. Unless we are talking of some children with a high grade fever, adults usually do not get convulsions during a fever. Okay. Yeah, I have seen old age people who get convulsions in fever or just without any reason. But these cases are rare. If there is a convulsion, there may be some serious issue going on in the brain. We should screen the brain by doing either MRI scan or a CT scan. And then we should keep a high index of suspicion. What if it comes next? So we should not wait. First convulsion, still you can avoid going to a doctor, but Second convulsion onwards, you have to seek a medical help from a neurologist or a neurosurgeon.
Seeking a medical help, you know, some people who suffer from this illness, they have families. Maybe the ways that you can advise the families on the ways of taking care of this person, what can be such of the tips on how to take care?
One of the most important, two most important things here when we talk about is that don't think this is a witchcraft. This is not. This is a very specific area. Just like you get a chest pain, mostly you're going to get either a heart attack or there's some acidity going on, right? If you have a headache, then there's something else. So now we don't consider headache as a witchcraft. We don't consider heart pains as witchcraft. We don't consider abdominal pains as witchcraft. Why should we consider epilepsy as a witchcraft? It is not. Okay. There are so many ways to control or cure epilepsy. We should always investigate very well. For the families, it is very important to know this. Number two is, when a patient is getting a convulsion, do not feed them. Just keep them on their left side. So if they're lying down, then you turn them on their left side and just wait. Do not put anything, no water. There are a lot of people I've seen, they start giving them some shoe to smell. It happens in India. You're giving some onion or something, or a milk, or they want to put a spoon
put the
or
onion.
something. Yeah, so none of these things will work. Never put your finger in a mouth of a convulsing patient, because the power generated by brain can be so strong, they can crush the bone of the finger, not only bite the finger. Okay. It can be because the masseter muscle which chews is the strongest muscle of the body. It can generate hundreds of pounds of pressure. So it can crush the bone in convulsive stage. Never put anything in the mouth. Never put a liquid in these patients' mouth, because they can aspirate, it can go into lungs and they can die. So just put the patient on the left side, just wait for convulsion to go. It almost always stops, 99%. Okay. And then you make them rest, then you seek a medical help.
And you've mentioned something about death. So my next question was coming there about, can it cause a death?
As I told you that if aspiration happens, say someone ate a big meal or drank, and after that had a convulsion, that whole thing was during convulsions, a lot of things contract, the muscles contract. So if a stomach contracts, it can purge the entire thing up. And then the breathing pipe and the food pipe are together at one level. So it can just go there and do it. Or if, I mean, it's deadly also. Suppose someone is driving a two-wheeler or four-wheeler. In case of two-wheeler, there can be a serious head injury and death. We have seen several. If you are driving, then you can kill others. If you are on a height or near fire, we have seen so many cases of burn because of epilepsy. So yes, it can cause death, not primarily, but primarily it causes brain damage, but it can cause because of some other reason, because you became unconscious. You can fall anywhere. So
and also the way they take care of you, the time that you are in it, it can cause death as well. The way you've
as I said, that if you start doing these things, you put liquid, or you know, putting a liquid can be really life-threatening.
Maybe as we wind up, maybe, you know, some people, they may take it like it's a witchcraft, because maybe they've tried to take their first medication or their first treatment, and they find out that it is not working for them. So maybe my question can be, what is the alternative if maybe the first medication is not working for me?
Just trust that medicines work on epilepsy. Okay. Medicines work. They will only, sometimes they work single, sometimes we need to change the dose, sometimes we need to add one more drug. So usually earlier the convention was that you go up to 3 drugs to stop a convulsion. But you gradually start from one drug, you go from lower dose to higher dose, and then you go towards the level where patient can get side effects of the medications. Then you go slightly down and see here whether the convulsion is still happening. That's what we do. I mean, patient cannot do it. So you understand that this is what is done. If that patient is still having convulsion with now lesser frequency and lesser intensity, then is a time when we add up another drug. And then earlier convention was that we do 3 drugs before we start thinking of surgeries, but know that surgeries can cure, not control, mostly cure 60 to 80% of patients if they are selected rightly. Okay, so there's a lot of workup which is required, there is a team which is required, there is a thinking which is required, there are a lot of diagnoses required which are not available in this country for now, but we are still going there. At least we are halfway through, that we are doing those tests, we are gathering the data, we are keeping the patients in our waiting list that, okay, if this patient beyond this point goes, then we have to talk about the surgeries. Yeah.
Maybe my last question, it's about the lifestyle, because you know, we have to, even these people suffering from this illness, they have a lifestyle to live in. So maybe what are some of the cautions that you can try to advise them?
Yeah. One of the core concept is that the brain cell is hyper irritable. It suddenly gives there is a storm of electrical activity in the brain which is causing convulsion.
Yeah.
So if you knew a very famous cricketer called John T. Rhodes, he was world's best fielder. He used to make catches. He would, in his mind, quickly think where the shot will go, and he will jump on that side and create a catch. He was epileptic. So epilepsy means hyperactive brain. Sometimes it is translated into high intelligence as well. They are very fast thinkers. Okay, they can be a little restless. They can speak very fast. So in short, the brain cells are overactive. If you do certain activities which are going to irritate these brain cells further, say alcohol, say drugs, say you are waking up too late in the night, you are watching too much of screens, too much of bright lights, all of these cause problems, and they can predispose you to convulsions. Also, if you are on a medication, you cannot smoke or you cannot drink, because if you drink or smoke, then these are the things which actually clear the drugs from your body very fast.
Okay.
Yeah. So no, all these things.
At this point, I think we can end our show here. But if maybe you have a parting shot that you can tell our viewers.
I just want to reassure people that Nairobi Neurocare is doing a lot in epilepsy field. We are trying to identify patients who cannot be treated with medicine. We are already doing epilepsy surgeries here in this country. We have successful cases. So there is a lot which can happen if patient doesn't have an abnormal area in the brain which can be removed. Then there are devices to put in the brain or around the brain which can stop convulsions to a very significant level. So there is a whole lot of workout which is available with us, and you should not afraid. Epilepsy can be treated, and in many cases up to 60 to 80% it can be cured. So rest assured, if you have any such problems, you can contact us, and we can do few of the best things which are available in this country.
Maybe mention the locations.
Yeah, we are located in Parklands. You can easily search us on Google. We have a website. We have a Google profile. Just type nairobineurocare.com or Nairobi Neurocare, and you will find us very easy.
Thank you so much,
Yeah,
Dr.
thank you so much.
Now, and out of that, it shows that epilepsy can be cured according to the testimonials that Dr. has told us today in our show dealing with the topic epilepsy. And thank you so much, my beloved viewer, for watching us and selecting Horizon TV this morning. I hope you've enjoyed the show. I hope you've got and understood a lot of the information to deal with epilepsy, and you'll take good care of yourself. And if you're not diagnosed with this, and maybe you can try to spread the information. You say you spread the information so that at least each and every person can get the information on how to deal with this type of illness. My name is Dr.Mahendra Gaddafi, and remember, the program was brought to you by Nairobi Neurocare. Till next Tuesday, same time, same place. Assalamu alaikum wa rahmatullahi wa barakatuh.